Hey guys, this is Ice-T 318 here again, going for another video similar to the last one, but instead of focusing on antidepressants, this time we're going to do anxiety medications. So on the agenda for today, there's going to be less topics than last time, but we're going to go into a little bit deeper on some of the history of anxiety medications. So before we get into it, if I say the word anxiolytics, that means anxiety medications. That's just a word that's used to describe medications that treat anxiety. Secondly, um, there might be slightly lower quality in this video in terms of the content, just because there's so many different anxiety medications that I would be here for literally 5 hours if I were to go through all of them. So this is just going to be a very brief overview. So I'm not going to go as deep into like the side effects and all that stuff. Um, More just like, hey, these are the medications that are commonly used. Here's the history of how anxiety disorders have been treated. And boom, we'll be done. So, history of anxiety medications, modern anxiolytics, then show you my sources like I always do. So, history of anxiety treatment. So, classical antiquity. This is describing kind of like what people think of the ancient Greeks, the Romans, classical period. Um, Believe it or not, anxiety disorders are the most common psychiatric illness and a leading cause of disability worldwide. And there's no reason to believe that it hasn't been the case throughout history. Historians write about it, doctors write about it from so long ago. So in the Roman Empire, some physicians used opium-based medicines to produce anxiolytic effects. That was around 200 AD. They didn't have modern opioids. They didn't have your perks. They didn't have morphine, but they did have opium-based medicines. Sometimes they would mix it in with wine to treat anxiety, which honestly, some people still treat their anxieties today by drinking wine. Not that you should, but that's just how it was back then. The Romans actually classified anxiety as a medical illness. Um, in physical philosophical schools such as the Stoics, Epicureans, they used philosophy and rational therapeutic approaches that are pretty similar to modern therapeutic techniques like cognitive behavioral therapy. So a lot of times they will say that Stoic philosophy is kind of like the building blocks of modern therapy. Um, Ancient Greeks and Romans considered anxiety to be produced by physiological and psychological causes, so they tended to look at these things as illness. Um, you had the Greeks, the Hippocrates, all those people, they didn't necessarily think it was a spiritual thing. They thought it was more of like something physically is going wrong here, therefore we can treat it with things such as the opium, the wine, stuff like that. Getting into the medieval era, some of the previous ideas about anxiety from the Greeks and Romans persisted, that it's caused by physical and psychological causes, but there's more of a shift towards moral and spiritual causes. So resisting sin and having spiritual discipline was often a treatment, and that's something that's still seen today in America. You'll have people, especially religious people, that will say, a lot of times, if you're anxious, maybe you need to pray about it. That was kind of the prevalent thought in the medieval era. So it was a medical and a theological approach, but overall not as naturalistic as the classical period. So kind of a shift from that physical causes to more of the spiritual causes. During the Renaissance, we kind of had a return to the naturalistic approaches. So treatments included diet, exercise, guidance on ethical conduct, spiritual discipline, cultivating virtues, kind of a link between the past and future concepts of mental health. So kind of return to form, more of a scientific study, kind of getting into that. So the 1800s to the present, it's been more of the scientific approach, based on observations, and treatments and research. So this is kind of when in the 1800s onwards, we established the modern classifications of mental illnesses. So the first edition of the DSM was published in the 1950s. the DSM, it's on the DSM-5 now. I believe the 6 is coming out at some point soon. But 1800s onwards, that's when we start diagnosing, labeling, treating mental illness in the modern sense of it. So also at this time, modern medications began to be developed. So getting into the modern anxiolytics, as we get into this, there's less research on anxiety medications in recent years compared to medications used for schizophrenia, bipolar, and major depressive disorder. I'll say this in every video that I talk about mental health, but there's a lack of research into mental health in general compared to other areas of medicine. But anxiety medications, for whatever reason, less so than even other areas of mental health. So the first kind of modern medications that were used for anxiety are what are called the barbiturates. So this would be phenobarbital. Before this, in the early 1800s, you have like morphine, chloroform, alcohol, opium-based medicines, still kind of how it was in, way back when. But barbiturates, they first were introduced clinically in 1904. They're still used today as like sedatives. They're used for seizures. They're used for anesthetics before some medical procedures. But they're rarely, if ever, used for anxiety today just because side effect profile, they're pretty addictive as well. And then the second kind of anxiety medications that I'll go over is the benzodiazepines. These were first invented in the 1950s. They are including your medications like Xanax, Klonopin, Ativan, Valium, and they're still among the most widely prescribed anxiety medications in the world. There's kind of a push to move towards SSRIs and SNRIs as the first line treatments. In fact, there is a push for it. But there's really a lack of strong evidence that SSRIs and SNRIs are better than benzos or better tolerated when it comes to short-term treatment of anxiety. Benzos start working pretty much right away. You take a benzo, your anxiety lowers. Where some of the other medications we'll get into, they can take weeks, even months to get the full benefit. But the reason that benzodiazepines are no longer the first line treatment in anxiety disorders are because they have addiction potential. There's issues with dependence. There's concerns with falls in elderly people. So there's an increased stigma around using these. There is some evidence, but not conclusive evidence, that suggests that benzodiazepines, when you use them for a long period of time, increase your risk of neurocognitive disorders like dementia. So that's another reason that a lot of psychiatrists today are moving towards other options for anxiety. So oftentimes they're still used very, very frequently, but usually as like an as-needed anxiety medication because they start working right away. So they're used with a lot of these other medications I'll get into. So antidepressants, the last video was all about antidepressants. So I'm not going to go through all the different classes and all the different names of all of them. But just to know, SSRIs and SNRIs, so your Lexapro, your Zoloft, your Prozac, your Effexor, Cymbalta, those medications are now the first line treatment for anxiety. They have lower risk of kind of the bad side effects of benzodiazepines. They have less of that abuse potential. Actually, there's really no abuse potential for an SSRI. You can't really get a high from it. So yeah, those are the first line treatments, antidepressants like the SSRIs, SNRIs. Other anxiety medication classes that are used today, there are certain cardiac medications that are used for anxiety today, specifically like beta blockers like propranolol. You're going to get used to me saying this, but when I was doing the research for this video, there's actually quite a lack of research that a lot of these medications are really that effective for anxiety. A lot of it comes from anecdotal experience of, people will take this medication and say, hey, it helped with my anxiety. But as far as like randomized control trials are really the strong evidence that we saw in last video with the antidepressants, not a whole lot of evidence when it comes to these ones. So propranolol, it's originally made for hypertension, tremors, atrial fibrillation, a lot of different things. but there's not much evidence for it working. There's other cardiac medications like clonidine that are used for hypertension, high blood pressure, that are also used in the treatment of anxiety, but again, not much evidence. Buspar. This is a medication that is very commonly prescribed, especially alongside SSRIs and SNRIs. There's some evidence that it can be as effective as benzodiazepines, but it's not super well tolerated. It causes a lot of nausea and dizziness in a lot of people. And it takes longer to start working, usually 10 days, a few weeks at least, before you're getting that full anti-anxiety benefit from it. It is also not addictive, which is why a lot of people are going towards Buspar. And then antihistamines. So there's a medication called Atarax that is very similar to Benadryl that's actually very commonly used today for anxiety. It's actually FDA approved. There is actually quite a few studies showing that it is superior to placebo and comparable to benzodiazepines in terms of effectiveness. Side effects that you'll see with that medication are dry mouth, constipation, and sedation. And then just a quick tidbit, because I like to go through the history of things. There was a term used in the ancient times, the Epicureans, going back to the Roman era. They had a term called ataraxia, which meant a state of tranquility, which is actually the basis of the name for this medication, Atarax. The generic name for it, why can't I think of it right now? Hydroxyzine. That's the generic name. Anticonvulsants are another class of medications that are used for anxiety treatment. These are medications that were originally created to treat seizures. However, a lot of times they're used to treat anxiety today. These would include your GABAergic medications, so like Lyrica, gabapentin. Those medications are actually used for nerve pain. They can be used for insomnia. They also have a huge variety of ways that they're used. But unfortunately, there is not much research showing that these are very effective. But the most evidence is towards Lyrica and generalized anxiety disorder. Gabapentin, not as much research. Some of the side effects from these medications are going to be dizziness, sedation, weight gain. There's an anticonvulsant, anti-seizure medication called lamotrigine that's also being used for anxiety, but again, very few studies pointing to that it actually works. So yeah, this is kind of the brief overview of medications that are used to treat anxiety. By no means is this a conclusive list. There's so many different kinds of drugs used for anxiety that, again, we'd be here for hours if I went through all of them. So just a basic overview. And then the last caveat was the primary source I used for this was published in 2020. So since then, it's been about 6 years. There's likely more research that's came out showing more research for these other medications. So just be aware of that. But yeah, I just wanted to post a quick video. I needed something to do after work today. So this is what I chose to do. You guys have a good rest of your day.